So I joined the summer school because I'm a public health doctor and I've got a lot of research ideas, but it's trying to make that step into putting the research ideas into research questions and study designs and hopefully coming out with a good research project.
So part of the reason why I participated is because Professor Gensichen and my supervisor were sort of in touch, thinking about collaboration, and I thought that this would be a really great opportunity to sort of push that maybe forward a little bit, get some contacts in Germany because I'm planning on moving back to Germany after finishing my PhD, and it's a good opportunity to meet other people with similar interests, sort of talk about primary care research and push my own ideas forward. That's the main reason.
The most important reason for coming here was as a public health worker to came into the mind of the GPs to get to know how they are thinking and yes, to do a better research.
Well, I intended to refresh a little bit my knowledge about research in primary care. I have done it 20 years before, and now I'm again in a situation where I can probably do something with data I have in my new practice groups, and so I look forward to probably do again some research or at least evaluation assessment of our primary care work.
So the director of our research institution is also involved with EQuiP. So that was a great possibility actually for me to being here and getting to know other researchers, so networking and also exchanging ideas.
So we take each project now, you try to phrase what was your aim paragraph, I give a few comments on it and we stop it there.
So the aim is to find out if acute therapy provides a better control with less side effects.
But it would be improved if it could be fertilized a little bit more.
That's to explore type 2 diabetes patients' information needs regarding their medication in general practice to improve their compliance.
If a patient with multimorbidity has a higher compliance, if they are included in a structured disease management program for diabetes.
What is a structured program, what is a comparison, that is okay to leave to the method part of it. And the same is, how do you define multimorbidity?
Okay. The aim of the study is to investigate if parents' education prior to childbirth can reduce the use of emergency services and of ambulances in children's hospitals in case of high fever and vomiting in babies from age to 0 to 6 months.
You all managed to go for this. The aim is to investigate if, reflect a little bit on the process you have passed now, because you have passed this important. Here we have the big world, we have a problem in the big world, other people have worked with the big world, there are some white spots, therefore we need some investigation, and here is the aim. So you have gone all through these phases.
Most of our projects we have prepared here yesterday, most of our aims are complex situations. Really complex. It's not that easy like in bioscience where you have a clear, rational, biomedical or biochemistry mechanism of action. Here you have a complex situation. So you start with a certain control group and a certain intervention group, and after a certain period you cross over, you change them.
Do you sample on patients or do you sample on exposure? If you sample on patients, you are in the case control design. If you sample on exposure and look into the future whether they become patients or whether they survive, you are in a follow-up or cohort study.
You have to put your quantitative study and your qualitative study in this study design. This is the design of how you want to analyze your data, how you want to gather your results.
And now you should go through the next phase, is trying to broaden out how you will come from this spot down to the result part which comes later on here. And how should you do that? Again, the best you can do is Pico or Pico S, where S was the setting.
The most useful thing for me has probably been talking to other people, talking to supervisors about my own project or my own project ideas, networking. So just having contacts really, but not only networking, but just getting to know lovely people and exchanging ideas and just broadening your horizon a little bit in terms of research.
So the best thing about the summer school has been systematically and structurally thinking through my research topic.
To coming into a discussion with the other people and the other disciplines. And yes, the value is also very good.
What was also very inspiring was a practice we visited yesterday about patient empowerment and the life world, so Lebenswelt approach was very inspiring for me, and also enlivenment, which was a main term.
And if your project can be boiled down to that, then you have made a good project. But if you write a long postcard, dear aunt, I'm about a project with something with old people who don't really know how to handle their life, and we are doing something in the hospital with them, but I don't really know if I can make the doctors do it. But the preliminary results show that, and maybe in a few you can hear it. If your project can be reported in a postcard, then you are about to have a success.
I'm a DEGAM representative from Ukraine, and I'm very excited to be here in this wonderful EQuiP summer school. And I have some experience of research before, because I made my PhD research, but I really found out a lot of useful and interesting things here, how to conduct the research work. And I would like to propose and to advise all young general practitioners to participate in this wonderful EQuiP summer school, because you can find out how to really start your research, how to formulate the aim of your study, and what methods you need to choose, and in the end you can make your design of successful research. So welcome, it is really useful.
It's especially good for somebody who's still sort of a newish researcher, or somebody who's just not really worked in the scientific field for that long, just to get early ideas and to be really guided sort of through the process step by step. I think it's very useful in that sense. And as I said, you meet lovely people that can hopefully form into collaborations in the future.